When we talk about Lee Health, we're talking about a health system that's been in this community for over 100 years, has 5 acute care facilities, 90 plus off-site locations. I'm always looking for ways to incorporate new technology that's out in the market. We have a centralized dispatch center that is 24/7 and monitors upwards of 3,000 cameras system-wide. At any given time, an incident can occur in this building, at Cape Coral Hospital, at Health Park Medical Center, and we can pull those cameras up at the click of a button and see what's going on.
The great thing about this is a centralized location, and we call it the CSOC. We have our dispatchers here. They're answering the phones, they're answering the radios from our public safety, and if anything comes up, they're able to dispatch to public safety officers. So one of the things that we're really proud of is HUG's system that we use to protect our babies. We have it here at Golisano and in Health Park with our mom and baby units. It's a small little device that goes usually on the ankle of a baby, and it monitors their locations 24/7 or as long as the baby is within our facilities. When that band gets to those exits, those doors automatically lock down, and then the strobe will start flashing.
It's a siren built into a strobe with audible as well. When I saw that product, I thought, I can use that at Lee Health. I can use that to fix an issue we're having in one of our units when we have an activation on our infant protection system. The staff saw that we listened to their concerns and we found a way to fix it.
The types of workplace violence that we experience in healthcare is physical battery, assaults, threats, incivility, and overall attacks against staff in a verbal or physical manner. We have to take a proactive stance against workplace violence. It all begins with de-escalation. It's part of our safety and security plan within Lee Health. We began from an orange banding program. What we did was we took an orange band and were able to apply that to a patient's wrist, and an orange square that would be attached to the doorway of a patient's room, which allows us to have a visual cue that there's potentially a risk of violent or aggressive behavior while you're entering that space. We leverage technology to, number one, be a visual deterrent, and number two, assist us with internal and external investigations. We also use our technology to assist in our police partner relationships to provide footage for their investigations. We've seen a drop with instances of workplace violence, in particular physical violence, across the system.
We had a major hurricane come through this area a few years ago in Hurricane Ian. It not only impacted our community, but it impacted our hospital too. We saw the devastation happen in real time. The Children's Hospital saw a full evacuation. It wasn't because there was severe damage to the building. We had no running water in this facility. On site here, we had over 500 vehicles that ended up being totaled. We were able to give their insurance companies a copy of the video. When we built this hospital here at Golisano, they were a little weary about the technology. But once we showcased what it was able to do for them, they were completely hooked and bought in. We're not just a security team, we're a compassionate security team that does more than just public safety.